Welcome to the Confidence Interval, talking science, people and population health. We explore the research happening at the MRC Epidemiology Unit, University of Cambridge, and meet some of our researchers to find out what makes them tick.
As I've said, lots of local authorities are doing this. So we used 40 instances of adoption over the course of a decade to observe what happened before and after the policies came into effect. And we noticed that fewer applications for hot food takeaways were being received by local authorities after adoption. They were able to reject a higher proportion of the applications that were being received. And ultimately, as you might imagine, that led to fewer new takeaways opening in the post-adoption period. The question then was, what might that mean for health and the economy?
Healthy neighbourhoods help people make healthy choices. Researchers funded by the National Institute for Health and Care Research have developed a toolkit which helps local authorities implement takeaway management zones, particularly near schools. I spoke to one of the authors of the research and the toolkit, Dr. Tom Burgoine. Tom explained what a takeaway management zone is.
Well, it's not one thing, that's probably important to say, but the essence of takeaway management zones are an attempt by local authorities to reduce future proliferation of hot food takeaways. And the management zones themselves are areas around schools where new takeaways aren't allowed to open. So that's how they hope to achieve that. So they're effectively trying to say no to new takeaways in the areas where children and young people spend a lot of time. Right? So that's the essence of what a takeaway management zone is. And the actual specification is very varied, from kind of 200 to 400 metre buffers. Some of them are round, some of them are based on the street network. Some of them do and don't exclude kind of town centres when they overlap. There's a whole bunch of kind of nuance, but in general, there are areas around schools where new takeaways won't be allowed to open.
And why shouldn't they be allowed to open in those areas?
Yeah, absolutely. Well, it's all about protecting vulnerable populations, actually. So we know that kind of behaviours that are established in childhood and in young people persist into adulthood, and indeed kind of weight persists into adulthood as well, it tracks. So I think that the logic is that if we help young people to eat healthier by kind of changing what their food environment looks like, and changing their food environment, may help shift their dietary patterns to be more healthy, they'll become healthier adults and we'll have a healthier population.
Isn't there an issue around that kind of old adage of, and I'm not going to quote it properly, but if you can't have it, so you're going to want it more and you're going to find it somewhere else?
Yeah, well, I suppose the thing with these management zones is that they're ostensibly focused on school children and they are anchored to school sites. But actually, when you look at how individual zones add up across a whole local authority, frequently anywhere between 25 and 50% of the local authority is covered within a zone. So we can actually, they don't just affect people's school environments, they affect people's commute routes, they affect children's home environments too. In fact, they affect whole populations. And that's the beauty, I think, of these management zone policies, is that it's perhaps a politically acceptable way, because everyone cares about children, quite rightly, to effectively kind of change what the food environment looks like across whole areas and therefore whole populations. So yeah, they're not just about schools, actually. They kind of shape entire areas and therefore they shape behaviour outside schools for children as well.
I have sort of questions around teaching people to not eat unhealthy foods, local economies, stuff like that, but we'll come to that a little bit later. First off, it's going to sound like a daft question, so I do apologise, okay. But what prompted you specifically, to investigate and research the issues around takeaways near schools?
Okay, well, I've been here at the unit now for over 10 years, and I've spent a lot of that time working on hot food takeaways and working on kind of the potential impact of hot food takeaways on population health through kind of using big data sets that are collected in the unit to examine what people are eating in relation to where they live and how much fast food or hot food takeaway exposure they have. And what was coming out from that research time and time again, and that was here in Cambridge, Cambridgeshire, London, and in other cohorts around the world, was that there appeared to be some sort of kind of consistent relationship between having more takeaways in the home environment and in the work environment and eating more takeaway food, weighing more, having a higher risk of obesity. So I'm more and more convinced, as the evidence kind of suggests, that there is a relationship there, and it may be causal. The consistency of that pattern, I think, kind of leads me to think that there's some sort of causal relationship there, that exposure prompts people to eat unhealthy and therefore kind of weigh more. So then the question becomes, well, what can you do about that exposure? How can you shift, how can you change that exposure to help people to kind of lead healthier lives? And this is one way that local authorities have been attempting to do that. And actually it's by far the most popular planning intervention addressing takeaways that has been adopted in the UK to date, I think, by nearly 40 local authorities over the last 10 years. So it seems to be an obvious question, right? If this is increasingly being adopted and is increasingly going to be adopted in the future, don't we need to know how effective it is? Because there's always a human resource cost, an economic cost, a political capital cost associated with doing anything. And if this intervention isn't effective, we should be doing something else. So that's really kind of how the evidence came together, with an opportunity to look at something and a need to look at something in case we need to refocus our efforts.
You mentioned the fact that this is becoming increasingly popular with local authorities. Why is that the case, do you think?
Well, takeaways are interesting because they occupy their own use class in the planning system in the UK. So they're discrete, they can be targeted by planning regulations in a way that supermarkets or cafes or other forms of retail and things you see on the high street can't. They're an easy win. They're something of a low-hanging fruit, perhaps. You can do something about them in the way that you can't do about other things. But it's also this build-up of evidence over the course of many, many years, decades, partly that we've contributed here from the unit, that suggests that they are a potential source of health harm. And that doesn't necessarily exist for one reason or another for other aspects of the food or wider retail environment. But kind of that is what it is. That's where we are. And right now, that means that takeaway management zones are a kind of a logical step. I'm sure there will be other things that need to be done. They're not the be-all and end-all. They're not the silver bullet. But right now, I think that's all kind of playing into the narrative, really.
So you mentioned that this has been going on for quite some time, this research, and you've been involved in it very heavily.
Yeah.
How did you go about gathering the evidence? I mean, it's one thing to have an idea that there is a causality between A and B, but it's another to actually evidence that.
Yeah, okay, so you're talking about the underpinning research. Yeah, absolutely. Well, that's where, I've been lucky to be here and to have access to some of the data from the amazing studies that are run out of the unit. So thinking of things like the Fendon study, that's where I have used, just where I've done most of my work, how I've done the data set I've used to do most of my work in Cambridgeshire. So that's a cohort of 12,000 individuals who live in Cambridge and in Cambridgeshire and kind of surrounding local authorities and areas. And I mean, it's an amazing data set. I mean, I think really it stands alone worldwide for the characterization and the detail and the richness of the data. We know so much about these individuals. We know, and of interest to what I do, we know what they eat. As I said earlier, we know what they weigh, we know where they live. From that, we can overlay data on the environment. How much green space do they have? How walkable are their environments? To address other questions, but particularly relevant here, what does their fast food exposure look like? Do they have access to a supermarket? All of that other stuff we can then overlay on top of what we know about our individuals, and then we have an opportunity to kind of relate one to the other. So my answer is so long, I forgot what the question is.
Basically, how did you gather the evidence?
How did we gather the evidence? Absolutely. So the evidence is based on relating kind of individuals' dietary behaviour and health and weight to what their environment looks like. And we've had a unique opportunity to do that over 10 years at the unit. But I mean, there are other great data sets, UK Biobank being one of them, 50,000 adults who live in London alone. And again, we know where those guys live, we know what they've been eating, we know what they weigh, we know what their environments look like. So we're able to do the same sort of thing elsewhere. And I think if you see the same sort of relationships in different cohorts at different times, but measuring the exposure in the same way, you start to think, okay, well, why are we seeing the same things in these multiple populations? Perhaps there's something going on here.
So what then do you know about the relationship between deprivation and access to hot food takeaways?
Well, we know that it's strong and consistent, and that more deprived neighbourhoods, generally speaking, have more access, greater numbers of hot food takeaways. We see that time and time again in the UK, in the US, in Australia, in many other countries across the world, and in many kind of regional studies in the UK as well as national studies. It's a well-established relationship, and it may well be playing into dietary and health inequalities. You know, we know that deprived populations generally tend to have poorer health, generally tend to have poorer diets, have a higher burden of obesity, and you know, part of that might be because their environments are less healthy. And what we've observed actually over the last 20 years, just in one area of the UK, just in Norfolk even, was that numbers of takeaways had grown by about 45% over a couple of decades, which is quite considerable growth overall. But if you break that down by deprivation, that was even stronger in deprived areas and much less strong in less deprived or more affluent areas. So actually, over that time, over that study period in that region, the difference between deprived and less deprived neighbourhoods had grown in terms of access to unhealthy food, which is concerning, I think, and the trends that we'd observed showed no sign of stopping. You know, this trend was just going up and up and up and was consistently stronger in more deprived areas. So I think that really asks some serious questions about health inequalities and what we can expect to happen in the future without intervention to overall population health, but also to health inequalities at a population level as well.
So one of the things that I'm learning as I interview more of the researchers here at the MRC Epidemiology Unit in Cambridge is that you're focusing on one aspect of a societal issue. So bearing in mind that what you do as one aspect of this then feeds into the more global or the larger conversation around health and health inequalities, food, access to good, healthy food. What kind of positive impacts have you found that your research is now helping to implement?
Well, it's a bit early probably for some of our recent kind of takeaway management zone work to be having an impact, but what we've certainly seen is very strong engagement. So we held a stakeholder dissemination event in Cambridge in September, and we had 70 representatives from local government all the way across the country and some from national government as well, who are willing to give up a day to come all the way to Cambridge to hear about our work. And our sense, like on the day, was that it was really well received and people were really engaged and kind of were excited to take away what they'd heard and discuss it with their colleagues. So, you know, I'm hopeful that that engagement will have impact, and we might see further local authorities, if and where it's appropriate, take up takeaway management zones, because the evidence certainly suggests they're going to be beneficial. But I think the very fact that takeaway management zones exist and local authorities are taking action speaks to all of the work that we've done before that, which we've discussed. And we know if you look at kind of local plans, planning frameworks, planning documents at a national and a local level, they're citing our evidence, right? So there's a direct link between what we've done and what local authorities are doing and what national government suggests to local authorities is important. The other thing that we've done is we run the food environment assessment tool out of the MRC Epidemiology Unit. So the website for that we can make a clear somewhere in a link. But that's a tool for measuring, mapping and monitoring what the food environment looks like, including over time. And we know local authorities, well, basically it gives local authorities data on what their food environment looks like that they might otherwise struggle to get access to. So it allows us to kind of start a conversation with them about what they might do, and in some instances, local authorities are using that to incentivise regulation, incentivise planning regulations, but also to serve as a yardstick against which new planning applications are judged. So some local authorities are saying when a new application for a hot food takeaway comes in, hang on a second, let's just check out FEAT, let's just check out the Food Environment Assessment tool, how many hot food takeaways are already in that area? Is that more or less, for example, than the national average? And if it's more, they're inclined to say no. Local authorities are using it as a data source to make decisions. And all of that comes out of our research that says that hot food takeaways are a potential risk factor for health. So all told, we're having impact, we're pretty sure of that, and we hope, considering the engagement we've seen with what we're doing now, that we'll continue to have that impact into the future as well.
You've been guarding this wonderful book here, lovely pink, called Managing Takeaways Near Schools, a toolkit for local authorities. The answer to this question is obvious, but why did you feel the need to create the toolkit?
Yes, I am guarding it because it's one of my few printed copies and it's very beautiful. And I can't take credit for the pink. We worked with a really great design team who helps us to put this together. But yeah, this is a practical guidance document very much aimed at the local authority stakeholder. And it's available on our website, freely available to all. Why did we produce it? Well, because we have a mission as a unit and I have a personal commitment to making sure that we do research that matters and that can make a difference and that has impact. But people in local authorities don't routinely read our scientific papers. As much as we'd like to think they do, not that many of them do. But they're far more likely to engage with something that is practical, gives them advice, talks to them in their language, and is much more accessibly written and kind of summarises our evidence in a way that is useful to them and that they can take to their elected members who are, members of the public and who don't want to engage with scientific research necessarily, but do want to engage with an accessible version of it. So this is all about maximising impact through making the findings of our research as accessible as possible. So in here we lay out a whole bunch of information. Starts with what are exclusion zones, what are management zones, some local authorities call them exclusion zones, and I slip into that sometimes. It starts with outlining kind of what they are, who's adopted them, and then it summarises our evidence. We've got a great infographic in there that local authorities can refer to, and then it takes local authorities through a 4-step process of how they can go about adopting management zones in their local authority.
So all told, though, you have a positive relationship with external stakeholders then, so health officials, policymakers, local government. How is that relationship helping you to move this research forward, if at all?
Yeah, we do have a really positive relationship, definitely. We've worked really hard on kind of building our networks in local and national government over a really long time now. And, we draw on those networks to shape the work that we do quite heavily. So this work emerged from an NIHR funded research project where we had stakeholders from national government as part of the project team, costed into the grant, right? They were helping us lead the research. But then we also had people who gave up their time for free to join a policy advisory group, and we met with them every 6 months throughout the 3-year project to make sure that we were still on course, we were still doing things that were of relevance to them, that the question was still one that they wanted answering, and many other things that we were consulting on them. So we're actively involving them in that. And then when it came to actually kind of writing this document, we were inundated with people who wanted to comment on it, tell us whether it would be useful, help us decide how to write it, how to shape it so it could be most accessibly to people like them. So we engage with these people in every which way we possibly can. And I think what we found is that if we draw stakeholders into the research as it's progressing, we get better research, but they're also more likely to help us kind of advocate for the findings when it's done too. And that kind of speaks to our impact agenda. Right? If we can get people talking about it to their colleagues because they're being involved with the research that's been progressing, that can only be a good thing. Does that answer your question?
Yes, it does.
Okay.
But there was a second part to that question,
Okay.
which is, how do you move this research forward?
Oh, what's next?
Basically.
Yeah, to be determined. To be determined, definitely. Probably for all that is exciting about takeaway management zones. And they are really exciting because they have retail impacts. We've shown that. We haven't spoken about it yet, maybe we will do, but they have had retail impacts. And associated with those retail impacts, we can expect in the future that we will have health benefits for local populations and net economic benefits for local communities too. And that's important because the most pushback we hear about within local authorities is from planning colleagues who are concerned about the economic costs of denying new takeaways a spot on the high street. And that's a legitimate concern, particularly in kind of deprived communities. But actually what the research shows is that when you take into account the savings from having a healthier population and the fact that anything else pretty much on the high street provides more for the local economy than a takeaway, we're not talking about economic costs here, we're actually talking about economic benefits. And for the first time, we've been able to demonstrate that that is likely what will accrue. So that's really powerful evidence. But for all the good things and all the promise that takeaway management zones have, they still rely on a planning system that is imperfect and is a bit of a blunt instrument as a tool for population health improvement. So, for example, we focus on takeaways because we can, but takeaways is a very broad class. Some takeaways are more healthy versus less healthy. They're not just all one thing. And we could revise the planning system in a way that takes into account what places sell. And then we could have regulations that are more focused on, okay, well, maybe this takeaway is going to send healthy food. Maybe this one gets planning permission versus this other one that doesn't, right? We could make more nuanced decisions if the planning system looked slightly different. I think actually for me, where I'd like to see my research go is to really envision what some of that change might look like. And then when we've got to a point where we could kind of come up with a suite of new interventions and the way the planning system could change to be more impactful, model and test some of that stuff in real life to see whether it... So that's what I would like to see going into the future, accepting that what we've done now is great, the planning system is a possible tool, but it's flawed, and start thinking about how it could change.
So there's a little to unpick there. You've talked about local economies and actually not having your hot food takeaways in those areas doesn't impact the local economy negatively. There's that question to kind of unpick. But there's also the issue around, you have your Joe Blogs, fish and chip, curry takeaway going on, and then you have your bigger, national franchises that sell what are considered to be some of the best sausage rolls going on. One clearly has the money to be able to turn up and say, but actually we're huge, we're big, we're well-known names. You can't really stop us from being at the city centre. And the other doesn't have that power, which I know is not a bad thing from everything you're saying, but is there a way to balance that? Is that something that you can't manage to unpick in your own research? And is that something that really should just be left up to the local authorities to deal with?
Wow, okay, so yeah, you want me to unpick my answers, and we've got a lot to unpick in your questions. What our listeners might not realise, actually, is that most of the big chain fast food outlets are not takeaways. They're restaurants. So they have sufficient seating that in the planning system, they're in a different class of restaurants, and they're not in the takeaway class. And that comes back to this thing about the planning system being a blunt instrument. And if you could reimagine the planning system to be a stronger lever for health promotion, you'd probably include major international chain fast food restaurants in a class that sold the same sort of food as your takeaways, right? So they're restaurants, and they're not subject to any of these regulations. And our sausage roll retailing friends would more than likely, although it does differ slightly from local authority to local authority, they'd probably be classed as a cafe. It's something about the food is already hot, or it's not cooked when you order it, or there's some nuance that means that they're not a hot food takeaway in most instances. They are in fact a cafe. So the regulations again don't apply to them. What then is super fascinating is that when the idea for these policies goes out to consultation at a local authority level, it's not the independents who object, it's the major international fast food retailers who aren't even subject to the regulation. But they're the ones who come in and say, no, this is unacceptable, and it's probably because this is the thin end of the wedge, right? And they see that the writing is on the wall for them if the direction of travel is towards regulation, right? They'll kind of, it's my working hypothesis that they want to put a stop to this early on. But to me, it's really interesting that they're the ones who object. The planning system is actually really interesting in general, because if you're rejected planning permission by your local authority, you can appeal that decision, and then that appeal is heard at a national level by the National Planning Inspectorate. So the decision is then taken out of local authority hands. And what we've seen is that actually there's quite a number of appeals that are overturned at that national level. So you have these two tiers of decision making. And there is some evidence to suggest that the National Planning Inspectorate has more of an economically focused mandate than the local authorities themselves. So you almost see kind of a watering down of local level policies when that decision is taken out of local hands. Besides, the national planning inspectors who work at the National Planning Inspectorate don't have any, or it's not mandatory for them to have any public health training either. So they may not be aware of the potential health impacts of takeaways, but what they're almost certainly going to be aware of is the potential economic impact of saying no. So this really fascinating dynamic of here's local authorities trying to do something for their population, and their mandate is public health. That's a local authority responsibility since a decade or so ago. And then you have decisions being made against them at a national level. I just think that's fascinating. So there's probably some more work to be done there as well.
Finally, what did you observe the impact of the takeaway management zones to be?
Yeah, so as I've said, like lots of local authorities are doing this. So we used 40 instances of adoption over the course of a decade to observe what happened before and after the policies came into effect. And we noticed that fewer applications for hot food takeaways were being received by local authorities after adoption. They were able to reject a higher proportion of the applications that were being received. And ultimately, as you might imagine, that led to fewer new takeaways opening in the post-adoption period. The question then was, what might that mean for health and the economy? That we were realistic about our chances of observing, but we were able to confidently model into the future. And what we have modelled is a reduction in mean BMI at the population level associated with that healthier food environment. And that reduction in obesity is associated with a reduction in the incidence of disease that's associated with higher weight. So fewer cases of type 2 diabetes, fewer cases of certain types of cancers and heart disease and so on and so forth into the future. So we've modelled those health benefits in 6 local authorities over the next 20 years. And then we've taken those health benefits and we've said, okay, if the population is healthier, how much will that save the National Health Service? So that's an economic benefit. And we've taken that information and weighed it against the cost of denying planning applications to new takeaways. And what we found actually is that that's a net benefit. So it's an economically good thing to do to implement hot food takeaways as far as we've been able to observe and model. And the important thing, it's not a harm, because that's really the crux, is that there's a concern that they are harmful to local economies, but actually, you know, our research at least suggests that they're not. They could be, in fact, beneficial. So yeah, that's ostensibly kind of the core of what we found. I suppose the other piece is that local people, local communities see management zones as necessary and potentially effective. So we did a piece of work where we included in a big survey of thousands of adults in the UK a question about whether they would accept management zones in their communities. and a very small proportion said they would object to the idea of management zones. So, that is really important, because we know that policies that are acceptable are generally likely to be adopted and have longevity and remain adopted and implemented well over time. And our evidence suggests that the local communities are not crying out, but in favour of policies like this, which I think is really positive. And we know that people in local authorities think that's positive too.
Thank you to Dr. Tom Burgoine. And to find out more about takeaway management zones and why and how the UK's local authorities can implement them, follow the MRC Epidemiology Unit on LinkedIn, X, Instagram, Facebook and YouTube.